We're really excited to share this presentation with you. You're kind of our first audience who shared some of this information with, so we're looking forward to hearing your thoughts and your feedback as well. So before we get started, we have nothing to disclose, although we may want to write a book one day. As well, we do have some photography that we'll be sharing of some work that we did with patients, and we have verbal permission from these patients to share their work for the purposes of educating others. So we'll talk a bit about who we are. This is Elana who's speaking. I'm a certified child life specialist, and I work here in the Pediatric Chronic Pain Program at McMaster Children's Hospital. I've also been a member of this PainCOP for maybe a year and a half, and I participated in the acute procedural pain toolkit. I was the lead on the distraction toolkit, and I had contributed to that in my previous role when I was working as a child life specialist here in the emergency department. So I've been in this position in the chronic pain program since last June, so coming on a little under a year now. And this is a brand new program. We're going to talk a little bit more about the program and our roles here, but thought I'd start with that introduction. So really, the world of chronic pain is a bit new for me, coming from acute pain and working in the ER. And I'll let Katie introduce herself now.
So I'm Katie Wilkinson. I'm a nurse practitioner here, and I transferred over from Sick Kids just in September. So I'm also very new to chronic pain and very new to McMaster Children's Hospital. My background was in general surgery, hematology, oncology, as well as complex care.
So our program here, our pain clinic at McMaster, is fairly new, and along with the new pain clinic at the Children's Hospital in London, we're part of a new initiative here in Ontario to promote competency and improve the services that we provide to young people with chronic pain. So our clinic was established in November 2015. The team has grown a lot since then. So I came on last summer and Katie came on in September. We've had some turnover of a few roles as we've established ourselves, and we have a pretty rocking team, I would say. We're very lucky. So we've listed some of the team members there. We are an interdisciplinary, I would say a transdisciplinary team, so it's really special. The dynamic that we've developed on the team here. And it's interesting because this is a new chronic pain program. We have healthcare professionals and allied health coming from many different backgrounds. So myself from the ER and Katie from oncology. We have coworkers from adult pain. We have coworkers from surgery and other mental health areas as well, and acute healthcare. So it's quite interesting, the mix of backgrounds that we bring. And as you can imagine, at the same time, in terms of developing a program and the language that we use and how we explain things, that's definitely been a journey for us here.
So we thought we'd tell you a little bit about the population that we serve and the kids that we see in our program. So in general, we serve kids between the ages of 8 to 18 years old, and some of them have known diagnoses and known reasons for their pain, such as post-oncological pain, Ehlers-Danlos, complex regional pain syndrome, chronic daily headache. But often these kids, they don't have good, clear rationale for their pain. A lot of it is not yet diagnosed or unexplained non-inflammatory musculoskeletal pain. These children often are not attending school. They have comorbid mental health disorders. There's a lot of complex family dynamics, sleep disorders, fatigue, and these children are often very sedentary due to their chronic pain and then have physical deconditioning secondary to that.
Thank you. Oh, sorry. Yeah, that's okay. Sorry, recording our slides here. All right.
I'm sure you can appreciate the complex nature of these patients, and due to that complexity and the many comorbidities, we have a very comprehensive 3-hour interdisciplinary assessment. And it includes a variety of clinicians, and it rotates. So there's always a psychologist, a social worker, a physician, either an occupational therapist or a physiotherapist, as well as a nurse practitioner. And the treatment varies and is individualized for every child, but it's really focused on rehabilitation and increasing function as well as quality of life. And getting these patients back in school and engaged in physical activity is really vital to the success of their treatment. And medications are not generally first-line treatment for pediatric chronic pain, but we may include SSRIs and anticonvulsants such as gabapentin, and we usually try to wean them off any narcotics or opioids if they have been prescribed those prior to coming to our program.
And like we said, our program's been around for a little over a year, so we wouldn't say that we have a typical patient or even a typical course of treatment. The treatment really varies. We have some kids who we see really on a consultation basis. They might come in for 1 or 2 appointments, and then we have other kids that have been followed in our clinic since the beginning. So it's definitely a mixed bag, and certainly I think the complexity of these kids and how long some of them have had chronic pain for has an impact on the nature of the treatment that we're providing. So we thought that we would start with a bit of an introduction to our program, particularly because we know that most people on the PainCOP have an interest in learning about other programs, and we are new, so we're trying to promote and get our name out there. And then Katie and I talked a bit about what we could talk about specifically for the presentation today. And we have been working for pretty intensely for the last little while on this initiative that we call Pain Neuroscience Education, and we thought that this would be of particular interest for this group as well. So what is Peony? Peony is a broad term. It's not a specific it's not a specific like intervention, but it's a broad name category for an intervention. It has other names. It's sometimes called pain psychoeducation, pain biology education, or also commonly known as explain pain. And Peony, it can be an intervention on its own, but usually it's provided as part of a more comprehensive treatment for chronic pain that might include CBT or physical or occupational therapy. Now, many healthcare providers still think of pain within a biomedical framework, but we know in this group, in the PainCOP, that pain is a biopsychosocial phenomenon. So when we use Peony in our program, it's to help introduce this perspective, the biopsychosocial perspective, to patients and families. And Peony, it's based on the idea that pain is in part cognitively mediated. So we can improve pain by modifying inaccurate beliefs. So our hope with this is that by helping patients and families to reconceptualize how they understand pain, we can decrease the perceived threat that they hold of pain and also increase their use of effective coping skills. And on the next few slides, we're going to talk a little bit more about the goals of Peony and the particular components. But first, we thought it might be interesting for us to talk a little bit more about how we even came to this topic as an initiative to take on in our clinic. I know that there's a lot of people in this group who are interested in quality improvement initiatives, so Katie's going to talk a bit about our journey in our clinic with Peony.
So as you may have seen earlier in the presentation, we started seeing patients here at McMaster, the larger team, in the fall of 2015. So we've had our 1-year anniversary, and at that time we were able to reflect on the care that we've been providing, look at areas of strength and areas for improvement, and also look at some trends and some common things that we were seeing through the patients and families that we work with. And one of the things that was common for us to hear is that these families and these young people had heard a lot of really hurtful and damaging comments from various providers, whether it would be family members, healthcare providers, teachers, and it often stemmed around their pain not being real, their pain being all in their head, them having a psychiatric condition. And in our program, we really tried to validate that their pain is real, we believe their pain is real. However, we weren't able to back that up with evidence. And when these kids had kind of heard those messages over and over again, we really thought we would benefit from having more evidence to be able to support why we know their pain is real, to kind of prove and to really validate them and empower them with that knowledge as well. And we also have a very large interdisciplinary team, and so we all had different language and different terminology, and we all conceptualized chronic pain differently. So when we were communicating with patients, we were using different language, we were using different metaphors, and some of the information we would be giving might actually contradict each other, not intentionally, but just due to the nature of we were all coming from really different backgrounds. So a need for a common language, a need for more neuroscience education for ourselves, and as well to be able to give that education to empower the families.
So we won't spend a lot of time talking about the research and the evidence for Peony, but I'll go over it briefly, and I'll direct you to the references there at the bottom, and the citations are on the last page of the presentation, and we do really recommend both of these articles. They're really fabulous in explaining the scope of Peony and how it can be helpful and talking about some of the clinical outcomes. I think what's interesting, the research on Peony, it's pretty much all based on research with adults. There really isn't any research on young people and how their understanding of chronic pain neuroscience can then have clinical impact on clinical outcomes. But the research is promising with studies that have been done with adults. However, there's a bit of a caveat, like with any research, that delivery methods for Peony are varied. It might range from groups to one-on-one sessions to written materials. So in terms of finding good systematic reviews, it's hard to do because these delivery methods do vary. And the populations are pretty heterogeneous. So you might have samples involving adult patients with fibromyalgia and chronic back pain to phantom limb pain. So there's quite a variety there as well. But when we look at more lab-based or isolated studies, those give some interesting information as well. So thinking of some of those like noxious stimuli tests or cold press tests that are done in lab settings, and in those studies have demonstrated that when participants are given information about like the threat value of a stimulus or told that something is going to be painful, then they do tend to experience more pain. And both of these articles list several studies with this type of outcome. So I think that's an important thing to consider. And we know anecdotally that when people are given information about pain or understand the meaning of it, and this is something we talk to youth about as well, it really modulates their experience of that pain. And I even tell you anecdotally from my own experience as a child life specialist, and we talk about this in the pediatric literature there that's cited at the bottom, that kids who are informed about medical procedures and know what to expect tend to show less distress and also rate their experiences as successful. I think one thing that we wanted to highlight, though, is that Peony, it's not an intervention on its own, but it's part of a comprehensive intervention. And it's really helpful to create a compelling argument for patients so that they can reconceptualize their pain and then have better buy-in to treatment. And then another thing we wanted to highlight from the literature is that there's some evidence to show that face-to-face delivery of information is more effective than providing written information alone, and that was one of the things that we took into account when developing our own Peony for our clinic.
So when we talk about the purpose of this intervention, and I really think that we've outlined it a bit in some of the previous slides, but a lot of it really is to shift their perspective away from pain meaning that there is danger, injury, inflammation in their body, and help them see that chronic pain is a problem with the messages being sent through the nervous system, and it's not being caused by tissue injury or danger in the body. And the pathophysiology we have to modify based on the patients, but for most of our patients that is true, although it can start definitely as an acute injury. And we find that giving this information really instills hope in the families, and it provides them with a better understanding of what's happening in their body, why they're experiencing this pain. And then it also provides that framework for building treatment on top of that. And when they understand why they're having pain, and our treatment makes a lot more sense because we can link it to the underlying pathophysiology and calming down the nervous system.
And I think what's important for us too is to give positive expectations, but also realistic expectations. So we talk with kids and families to help them understand that we can't promise that their pain is going to go away. And in fact, we don't want pain to go away because pain still has a useful purpose, but in chronic pain, we know that that useful purpose is no more. But to help them learn ways to manage their pain, to get back to the things that they want to do so that pain can decrease over time, that pain goes into the background, and they can really focus on life again. And there's a lot of good research on the role of optimism and positive expectations in healthcare, and in chronic pain, that holds true, of course, as well. So I'm going to talk briefly about the key components of pain neuroscience education. I'll refer you to this wonderful commentary by Coakley and Schechter that's published in the Pediatric Pain Letter that outlines what they see as the key components to include in this education. And they also go into quite a bit of detail about really useful metaphors and analogies for explaining chronic pain to kids and families. So we follow this format, and Katie and I will talk a little bit more specifically about what we do in our own Peony sessions, but in general, we start by talking about the difference between acute and chronic pain, and we emphasize that acute pain has a useful purpose. It acts as a warning to alert you to, pending danger. An analogy that we find really helpful for explaining the difference between acute and chronic pain is that of a computer. So we talk about hardware and software. And we explain chronic pain as a problem with the software or nerves rather than a problem with the hardware, which are the tissues and bones of the body. And families and kids seem to find this analogy quite helpful. The next component that we emphasize is talking about pain transmission. And what's interesting is most kids and families don't have even a basic understanding of the nervous system. If we were to ask them to label the parts of it, they for the most part wouldn't be able to. So it's really important when we're talking about pain to actually talk about what is the nervous system, what are the parts of the nervous system, and to provide some general information about how pain is transmitted with an emphasis on the role of the brain in processing pain and making meaning of pain. We talk about factors that impact the experience of pain. So the idea or the concept that pain is influenced by our thoughts, beliefs, memories, past experiences, and our emotional state. We talk about the mind-body connection, and we elicit the youth to think of non-pain examples of the mind-body connection as well. So things like blushing or feeling butterflies in your stomach when you're nervous. And then with regard to the chronic pain treatment approach, we find that it's really important to connect the teaching about pain neuroscience to our treatment. So we emphasize that the goal of treatment is to increase feelings of safety, decrease feelings of danger over time, to help calm the sensitive nervous system and decrease pain. And that over time, we emphasize that youth will be able to get back to more and more of the things that they want to be doing. Just to talk about some of the delivery methods for Peony, we talked about how in the research literature, it's hard to find what's the best because it's being done in many different ways. And what the research right now supports, and anecdotally what we found is most effective, is using a range of delivery methods. So the article that I mentioned previously talks about the use of metaphor, and we found that to be really helpful to explain pretty abstract information and to make it more concrete, and also to make that information more memorable. We also feel that the metaphors that we provide to our youth and families can then become tools for them to explain their pain to others. Then to make a note with regard to the group education, so we do run groups in our program, but we've chosen to keep the pain education that we do in our groups fairly general, and to make the Peony, which we provide in an individual format, we make that more specific to the individual and their presenting pain. And we've decided to do this because every youth's pain and their pain journey is unique, and we want to make sure that we're giving them the most individualized and relevant information. I've put screenshots of 2 of the videos that we recommend to our patients and families. These were developed by the Complex Pain program at BC Children's Hospital, and they're really fabulous. They're 3 or 4 minute videos. They have a youth who narrates the videos, and they're very, youth friendly. So after our Peony, we provide a handout with these videos, and we give it as homework for the youth to watch at home with their family to help reinforce some of the concepts that we've provided. And then with regard to developmental considerations, we'll talk a bit more later in the presentation about some of the ways that we've made our own Peony session more interactive and youth-friendly. You want to ensure that the resources that are being used are appropriate for the child's cognitive and social development. It's helpful, of course, to use multiple modalities, so we have written materials and props and videos and dialogue, using metaphors and stories. And then the other piece to keep in mind is the role of parents. So recognizing that the role of parents can change across development. With younger kids, we tend to do more of the teaching for parents and provide more of a simplified explanation for the youth. And also to keep in mind the impact that parents have on children's learning and belief, which I think can create an interesting dynamic sometimes in these sessions as well. All right.
So this is an example of one of our pain education sessions with a family. So when we would start our session, this would be a plain whiteboard, and then we slowly add information as we're bringing up these concepts with the patients and families, discussing them, and it's always very interactive. We know that just talking to patients for an hour is really not going to help them retain information. So it's always a dialogue, lots of going back and forth. And we have always 2 people. So there will always be currently, so myself, a nurse practitioner, to make sure that it's very scientifically sound, that we are linking the information back to their diagnosis and their pathophysiology. And then Elana has been incredible to work with. And as a child life specialist, she is extremely creative and able to bring in different teaching strategies and really target that information so that it's developmentally appropriate, and bring in tools such as a train and dolls, and you'll see more of the tools that she's brought in, but just really creative concepts. So the pairing of the NP for more of the scientific perspective, as well as child life for that creativity, has really been a wonderful dynamic and just a pleasure for me personally to work with. And we started off thinking that this session was going to be 30 minutes, and now it's an hour. And as you can imagine, there's a lot of concepts to cover, and we do reinforce with the families that this is kind of their primer. This is, we don't expect them to understand all of these concepts when we leave, but we feel it's important as these are key concepts that are going to be reinforced throughout treatment. And now all of the clinicians in our program kind of have the same understanding, and so they're able to link back to these concepts and link back to, do you remember in the Peony when you talked about the mind-body connection and blushing, and we have the same vocabulary now as a clinic.
All right, so the next 2 slides, we're going to share some photographs, and we're going to talk about some of the creative approaches we've taken to make this very complex scientific information a little bit more accessible for younger kids and for teens as well. This slide, by the way, is kind of the information that Katie shared, but we wanted to make sure that people had a copy of that, so we're going to skip ahead. So especially with younger kids, I had mentioned before that many patients and families, when they're coming into the clinic, don't know what the nervous system is or what are the components of the nervous system. And I think what's interesting in working with this population is that many patients and families have a misconception of pain being in their head or not having a true understanding of the physiology of pain. So we find that it's really important to ground the phenomenon of pain as a real physiological experience. So one of the ways that we do this is by talking about parts of the body. I've this is a wonderful body book. So often with younger kids, I'll start by talking about the body parts that they are familiar with. We'll talk about organs and we'll talk about body systems, and then we can make connections between, the digestive system, the circulatory system, and the function of those systems, and then to connect to the nervous system and its function in the body. This is also a fun book that has lots of flaps and it's very interactive, so the kids do enjoy that when we have younger kids coming in. I've recently purchased a book that has photographs that we're going to be using with our older kids, so that's a little bit more teen-friendly. Another way that we've made our teaching a bit more interactive, particularly for our younger participants, is with drawings with the soft cloth dolls. So if you are a child life specialist or if you've worked with one before, then these will probably look familiar to you. We often use these for teaching about different diagnoses, and I found these to be a really great tool when working with our younger kids who have chronic pain. So the first two pictures on the left there were with, I think she was an 8 or 9-year-old girl who had joint pain as well as chronic constipation. And then the photo on the right was a teaching that I had done with, this was before we had started our formal Peonies, that I had done with a 12-year-old boy and 2 of his siblings. And what we do is we look at the pictures of the body book and we talk about the different body systems, we talk about the parts of the nervous system, and then we label them on the doll. So this is a great way to assess the kids' understanding. So as they're drawing the parts, we're talking about their function and labeling them. And also often other, things come up. So the one with the 3 dolls, the doll that's in the middle there, this 12-year-old boy had spontaneously drawn his shunt that he had, and we talked a bit about that. And you can see on the other photo, the 2 that are on the left, that our young participant with chronic constipation drew her very large stool sitting there in her rectum. So there's that. This is another tool that we've been using. It is a video. I don't know if it's going to work. Let's see. It's quite quick, but this is a modified operation game that we created. And we use this to talk to kids about the difference between acute and chronic pain. So acute pain being due to injury or inflammation, and we demonstrate that with tweezer. And then there's a metal tab on the back, so when we simulate that, it represents chronic pain being a disorder of the nervous system rather than due to injury or inflammation in the body. This is a photo of with another young kiddo as well, talking about the gait control theory of pain. We actually had her we got on the floor and we did a life-size diagram of the body. We traced her, and then we had her draw her brain and the spinal cord and the nerves and label them. So again, that was a great way to assess her understanding, and then also to help her understand this pretty complex concept of the pain gait. And we compared that to a train, the pain train, carrying the message along the spinal cord and then encountering these various gating mechanisms, and the spinal cord that, when open, allow the message to pass through more easily, and then when closed, make it harder for that pain message to travel through to the brain. And we then went on to talk about things that can open and close the pain gate.
And lastly here, these are just some other examples, and every time that we do one of these sessions, I think we've done almost probably 10 now, every time it changes, every time we use different words based on the examples that are brought up by the young child, and we've made it more interactive as time went on. So one thing we added are the emojis. So after we describe part of the brain, then they're able to pick out an emoji that represents that part of the brain, just as fun little ways to keep them engaged and to add some lightness to all this.
It's a great visual cue too, so that's pretty fun. And you can see here one of the things that we emphasize is that pain is processed in the brain, and we use the example of getting a needle poke and talking about that experience, and we elicit in the youth to think about thoughts that they've had in the past getting a needle. We talk to them, how is it different from when you were younger to what it's like now when you have a needle? How is that experience different? And we like using the example of the needle so that we can show and talk about how, regardless if it's an acute pain or chronic pain, there's still an emotional component to it, and it's influenced by our past experiences, our learning, our thinking, and people around us as well.
So as we mentioned, this is still a fairly new session that Elana and I have been working on, and it's definitely a work in progress. We are getting a lot of positive feedback from the families and especially from other clinicians working with these patients afterwards, saying that they have a much better understanding of the concepts now when they're doing their psychotherapy or occupational therapy or physiotherapy as kind of a groundwork for their therapy moving forward. And again, continuing to add different multimedia tools, and one of our goals moving forward as well is to develop a written summary of some of the key information to send home with families after the session.
All right, so that's the bulk of the information. It's been pretty exciting for us to even put this presentation together and to reflect on the successes that we've had and really how far we've come in this journey. You know, that emerged from some frustrations and wanting things to be better in our clinic, and then working really hard to go to the research and go to literature and conceptualize what could be and then put that into action. So we're so glad that we were able to share this with all of you, and we do welcome your feedback or thoughts or comments. So we'll open that up to you guys.
Well, thanks so much. That was really great, Elana and Katie. Does anybody have any questions or comments?
Hey, it's Kathy here in Edmonton. This looks awesome, you guys. I love the whiteboard idea.
Thank you.
Katie, I sent you an email.
Oh, great.
I think Kathy got a sneak peek of some of these because I've been tweeting some of the pictures.
Yes, yes.
Oh, and hi, Karen.
This is Samina. This is Samina. I just wanted to say thank you so much for that presentation, and the way you two presented it. It's brilliant. It's I know you were presenting it as meant for the families or the children, but as a healthcare provider who doesn't work traditionally in chronic pain, I think the way you described the pain and how it's different from acute pain was actually very helpful as a healthcare provider as well. And if you don't mind, we might reach out to you and see if we can, if you were willing, if we could include this in our toolkits in some forms. I think there's some, of course, we wouldn't necessarily have the benefit of your explanation unless we did a voiceover, but this is a very lovely way to explain this to people who don't always deal with it. So thank you.
Thank you. That's really wonderful feedback.
It's Ashley. I was just wondering if you guys had any sort of anecdotal feedback from the families so far around what specifically this has helped change for them and for their kids.
Yeah, and Katie and I reflect on this after every session, and we've had some really good and interesting feedback from families. We had a patient who came last week who experienced this low back pain, and a lot, if not most, of our kids are pretty resistant to coming. This is often, our clinic is a last resort for a lot of families, and it can be disappointing when they come and we tell them that, no, it's not about medication, it's about doing hard work. So our hope is that by spending the time to talk to them and to provide this education and make it really relevant to them and individualized to them, that we can then create that connection and relationship to them. And we had a patient who came last week with her mom, a 13-year-old, with the low back pain, as I started saying. And at the end of the presentation, her mom turned to the daughter and said, you know, I think that they're really going to be able to help you here. And that was so validating for us to hear. And we've heard that from other families, too. And I think even in the short time we've been doing this, we've noticed a difference. Prior to starting this Peony session, we used to have a feedback session which would involve the members of so they would come for their assessment, and then a week or a few weeks following their assessment, the patient and family would come back for what we call the feedback, where we would share the treatment recommendations and then do a little bit of pain education, but it wasn't done in this systematic and interactive way. And we feel like families are able to hit the ground running now, whereas before it seemed to take a lot longer to get them around to our perspective and the way of thinking that we have in this clinic. So this is certainly, I feel, has helped to speed things up in terms of helping them understand why we provide the treatment that we provide and why it's not about medication.
That's great. Do you guys have any plans to evaluate it maybe or write it up?
We've got lots of plans. Nothing specific at this moment.
That's okay. I just think a lot of other organizations would benefit from what you're doing.
Thank you.
Okay, awesome. Are there any other questions before we move on? Okay, I will take silence as no. So thank you very much again to Elana and Katie. And if you have any more questions about their presentation, I mean, please feel free probably to either email Samina, myself, or Lisa, and we can redirect it to them to find out an answer for you.